Hi, everyone. This is our bi-weekly Healthy Root series, and today we're going to talk about how your beliefs affect your healing throughout your body. Not just the healing, honestly, it's going to affect your mental status, your energy, your motivation, your sleep, everything. But in here, we're going to focus on the pain, and we have our guest here, Dr. Crystal, who's going to walk us through this part.
All right. So, yeah, as Dr. Mark mentioned, this really affects every aspect of your life. But again, because you are here at Arthritis VIP, we're going to have a strong focus on how it affects your healing. So, if we can move to the next slide. So, I love this saying that I read in an article, and it says, your body and its trillion of cells hears absolutely everything that your brain says. And this can be simultaneously frightening because obviously if you think back to all the thoughts that you are hearing or thinking in your brain, they're not, sometimes they can be very unpleasant. But at the same time, this can be absolutely liberating because to know that you have the power of changing or thinking one way and having a completely different effect on every single cell in your body, that's incredibly empowering and liberating. So it goes both ways. And today we really want to focus on how this can be empowering for you and your health. So we're going to quickly dive into sort of that fight or flight response, which I'm sure many of you have heard about. And essentially what it means, thousands of years ago when caveman was fronted with woolly mammoth, that person would either fight the woolly mammoth, or they would freeze and hide from that big animal, or they would run away from that animal. And when the body responds or sees a potential trigger, it is going to respond in a certain way. So before you make the action of fight it, freeze, or flight, you're going to have chemical messages in your brain start to fire. And when they start to fire, they then talk to the cells to take action. And Mark, if you move to the next screen, it talks about that cortisol being released and the growth hormone being just decreased. And I think in previous conversations that we've had, you've done a really good job to sort of explain how that how that relates specifically to the work that you're doing with Arthritis VIP. So maybe you can explain that again.
Yeah, so when we get chronic pain and be stressed about the chronic pain itself is gonna increase the cortisol level. And cortisol level normally peaks up around 6, 7, 8 in the morning and start going down throughout the day. And it will be lowest at nighttime. That's when everything's gonna be more for rest and digest and healing and repair. However, and that's when the growth hormone is going to go up. So we have a window of that growth hormone between 10 p.m. till about 4 or 5 a.m. That's when we have the healing, the repair, building muscle, losing fat, even, believe it or not, absorbing food. The digestion happens throughout the day, only absorption happens overnight. So all the really heavy stuff happens at nighttime. That's where the growth hormone is at its peak. However, if we have uh, a stressful event or our chronic pain is causing all that stress and we're thinking about it from a negative point of view, that cortisol level stays up all day and night, and the growth hormone is trying to come up and it sees the cortisol is still in action because of the fight and flight. Growth hormone goes down, so it never spikes. So you never heal, you never repair, you never build muscle, you never lose fat, you don't die, you don't absorb your food, and it just becomes a vicious cycle because of
Yeah.
all of that happened overnight. Now chemically the body will be stressed out because you missed a milestone of your life. And imagine if you repeated that for days, weeks, or months, the cortisol level is going to be always up. It's always on alert because it's about life and death. It's not about building, repairing, healing, that kind of stuff.
Yeah. And so going back to the fight or flight response, you know, thousands of years ago, sure, it was the woolly mammoth, but unfortunately, evolution takes time. And now it can be something as simple as an email that you get, or being in a job that you don't really enjoy. Our body still, unfortunately, reacts the same way chemically. So if we move to the other slide, you'll see that there's an actual condition called psychosocial short stature disorder. And this is where if a child is left in constant extreme stressful situation or an environment, that fight or flight response is engaged, and that conversation or the topic of that growth hormone isn't being secreted appropriately, from what Dr. Mark just mentioned. And what ends up happening is that that kid actually ends up has their growth stunted, and they don't grow as tall as they typically should. They don't gain the appropriate weight, their bone mass decreases, and they actually cognitively don't perform as well as somebody who was not in the same environment. Now, if we move to the other slide, you'll notice that if you take that child out of the environment, the reduction of that cortisol goes down. And now the body actually gets the opportunity to secrete the growth hormone, and then regular growth resumes. And I mean, that, if anything, should show you the power of the way how our mind works in different environments.
I love that, and this is true for all of us. Even like in kids, it's going to be happening in the chronic pain. Just one thing I'd like to remind everybody about the stressors. It's about conditioning. As you mentioned before, you might be stressed about an email. So for me, maybe that email is a stress, maybe 5 out of 100. For someone else, they're going to perceive it as 80 out of 100. That response is maybe different from you to me to someone else. And if we know how to downgrade those responses, that closed loop of what really a stress is, we can downregulate that cortisol level. Because some of us can stress out for some really silly stuff. And you think about it with people that you hear it all the time especially in New York, where people are stuck in traffic, they get stressed out, they shoot themselves. Well, they think that the traffic is the end of the world, right? Because that, to them, that's like a mammoth is gonna step on me. Well, to you, like, you know what? I got delayed for an hour or two. Well, big deal. I still have my health. I'm still walking, I'm talking, and so forth. So that perception is very critical, and that's what we can play the game or the training of. I want to deregulate and really trying to differentiate what's real, what's not real, and deregulate that stress internally. And that's where I have control on. What I don't have control on, a war, I don't know, a thunderstorm, something like that, something outside of my reach. Yeah, that's completely different. But always anything that within my control, I gotta need to downregulate that.
Absolutely. Absolutely. So, I think I put this slide up here in our presentation about how stress affects the body. And I find that this graphic sort of summarizes the things that we've been talking about over the last several weeks. So if you can just proceed to the next, keep going one more. Amazing. So we can see that when you're under that constant stress piece, your brain starts to develop difficulty concentrating, you're feeling anxious, depression, irritability, mood, different issues. And actually, if you can just go back to the slide previously. Amazing. You can have impacts on your cardiovascular system. So the higher cholesterol, high blood pressure. And so for people who are going through the program at Arthritis VIP, you've probably also not only had other benefits besides decreased pain in general, but if you've been following along with the program in terms of doing, fixing the gut health, as you can see here, that chronic stress is going to have the diarrhea, constipation, fixing the gut, fixing the sleep aspect, you're going to start to notice other improvements in your overall body. And so, you can screen capture this slide just as a reminder of when you feel a certain way. So if you start to notice that your nails are brittle and dry, or you've got acne, or you've noticed that, like, man, I'm catching colds and flus quite frequently, don't think of them as independent, separate things. These are signs and symptoms that your body's telling you that it is under stress, and it's asking you to look at these things so that you can make modifications and address the stress piece. So on the next slide, if your brain is full of stressful and negative beliefs, and trust me, we've all been there. It's not that myself or Mark or any different from you. We've all had our moments. Your body believes that it's in that constant state of fight or flight. And so you get those negative symptoms that happen in your body. Whereas studies have shown that if you have a positive and hopeful belief system, these can heal you. I mean, I think we've all heard of stories, and they're few and far between, but they're pretty miraculous, where somebody has had a devastating diagnosis, and they believed that their body was capable of healing, and they knew that it was possible. And sure enough, they were able to heal themselves. And on the flip side, I can tell you a personal story. Our neighbor, his father was living with him, and he was smoked day and night. And he basically was having crazy, like, coughing up, hacking up. And I remember the day he went to the doctor, and the doctor told him that he was diagnosed with lung cancer. And I kid you not, 30 minutes after returning from home after that diagnosis, he had a heart attack and he died that exact same day. And that is the power of the mind. Like, there's no way that lung cancer diagnosis would have killed him within 30 minutes, but he believed in his brain that I'm going to die and it's going to happen. And, sure enough, it did. So, it's very interesting. And so that sort of leads me to the topic of the placebo or the nocebo effect. And go ahead.
I just want to mention something about the positive thing, because positive, like, again, same stories that you mentioned. We hear people, even from survival, we talk about people that got stuck in the woods or stuck in a forest or stuck in a desert, and 5-6 days later they survive. And one of the things is not about just believing, oh, I can survive. It's not the incantation of those words. It's what I found out personally is the positive thought. If you want to just about yourself, it's going to be just selfish. If you think about yourself is, how can I add value to others? I'm not ready to die, or I'm not ready to be crippled with my chronic pain. What value am I going to add to others? Even if you help one person or two people or three people or just the circle of your family, the more people that you have in your mind, I need to help out. I'm not talking just physically. It could be physically, it could be mentally, it could be like, you could be a mentor to them. You could be just like a good example. Anytime you go beyond your own circle, that value is much higher, and the body will work really, really magical to bring you back to because now there's a higher reason why you should survive. There's a higher reason why you should get out of the chronic pain. It's not selfish just about me because I want to get off my pills. Well, that's great. I just want to walk better. That's what's all personal. But if you add it, if you're able to expand that to a wider circle, you'll find that your brain will make you miracles in terms of healing.
Definitely. It's that sense of connection, right? So, like, I've had a teacher tell me once before that whenever you feel like you are sensing depression come over you, to do something that day for somebody else. If it means you compliment somebody, or if it means that you let somebody in traffic, or you donate to a charity cause, or you show up to something, you assist your neighbor with raking their lawn. It sounds so menial and it sounds like it's nothing, but when you engage in the community, in something that's beyond you, it lifts you mentally and emotionally, which then triggers that physical lifting and healing as well.
Absolutely. So we'll go to the next one, placebo and nocebo.
Yeah. So placebo effect is essentially, and as a naturopathic doctor, trust me, we get told about this a lot by society in general. And so essentially what placebo means, it's a drug or a treatment that really and truly has no therapeutic effect in terms of like scientific, when we look at it scientifically, but yet it produces a beneficial effect to that person. And it can really only be attributed to the fact that person actually believed the treatment would work. So there is a case that was reported in a medical journal where a woman came in with extreme nausea. And when they did studies on her gastric motility, it definitely confirmed that, yes, the reason why this person is having extreme nausea is because they're having problems with their motility. And the doctors basically told this person, we have a brand new, extremely effective, potent medication that if you take it, it's going to solve the nausea. And when they gave it to this person, within minutes, the nausea completely resolved. And actually, when they went to go check the gastric motility, it went within normal reason. Now, what's wild about that particular story is that they gave this person Epicac, which is a syrup that actually induces nausea in people. But this person who received that syrup or the medication totally believed in their every cell that this was going to work and this was going to do something for them. And it did.
Yeah.
And you can't explain that any other way other than their belief system in the treatment.
Yeah. There's studies,
and I'm sure, Mark, you see this too.
All the time. And there's studies that says it ranges between 15 to 18%. That's for the placebo effect.
Yeah.
And to the opposite contrary, where the negative 15 to negative 18%, that's what we're going to talk about, which is the nocebo effect.
Exactly. And so the nocebo effect is the opposite. And that's where if a person has a negative expectation of the particular outcome, they will actually have an even robust negative effect than would have otherwise occurred. So for example, and it's really funny because I see this sometimes when I do acupuncture with the patient. So if my patient fears that, I don't like needles, it's going to be awful, and they really have worked themselves up about the needle. When I tap the needle in, which bear in mind is like thinner than like a strand of hair, they will jump almost off the table. And you wouldn't expect that particular effect. And, this can also happen when somebody has doubts about feeling or getting better about a certain, about a condition. They typically don't get better. And I see this, and I'm sure, Dr. Mark, you see this all the time, but I can tell when I'm working with the patient, if there is a belief system that they think they're not going to get better, I can promise you, I can recommend 1,000,001 supplements. They're not going to get better.
Yeah. So that's one of the things we tell everyone that comes through our clinic. If there is a way, like you have a tendonitis, arthritis, and I know I can help you with all the procedures that we do, all the methodology we do, and we ask those patients, do you believe that this is going to help you? And if they say no, we're not going to take them as a patient.
Yeah.
Reason is, you already put in your mind that I've tried everything, that it work, nothing is going to work. Why should this work? You're always looking for something to make it not work. And the body will trust you. You said that it's not going to work, then it's not going to work. So we only take patients that really are motivated and want to get better and believe that they're going to get better. That's when you get the magical effect between not just the placebo, between even the actual mechanism of whether it's the prolotherapy, the PRP, the shockwave therapy, whatever modalities that we use. That's how you're going to get maximum effect and maximum result. You got to believe in what you do and believe that you're capable of healing too. We're just going to give you a jump start.
Yep. And, like I'm the same way in my own private practice. In my intake form, I ask the question, is there any part of you that fears or doesn't believe that you're going to get better? And if the answer is yes, I usually have a quick 5-10 minute conversation to kind of dig deeper about that. And if I feel like there's wiggle room in terms of like helping them see a different belief system, then we'll do it. But if not, if I truly in my gut believe that this person has bought into the belief system that they're not going to get better, I'm not the practitioner for them. And, I think what I respect the most about you and the work that you do at Arthritis VIP is that you're very upfront with patients. Like, you're not going to string them along and take them for all their money. Like, if you see that their belief system, they are tied on to this notion that they're not going to get better, I think you call them out on it and you say, okay, this isn't going to be the right relationship for us.
Absolutely, absolutely. It's just like, think about it like dating. You can't go into a date and you think it's not gonna work out. Then just don't go on that date. And you
Yeah,
can't continue and get married and say it's not gonna work out. It's not gonna work out. Well, yeah, of course it's not gonna work out. That's what you kept repeating all the time, and you will find any excuse that is not gonna work out.
exactly. To fit that belief system,
Exactly.
100%. Yep. So, on the next slide, we talk about, people who typically have a worrisome or a very focus on, like, it's my illness, it's my illness. It can always trigger your brain into that fight or fight stress response. And what ends up happening is that the cortisol and other hormones get literally like dumped into the bloodstream, and they just cause a cascade of other events that make you susceptible to more illness. So it's really important that we really focus on that power of the mind. And on the flip side, if you go to the next slide, when people think positive about their health, and when I say positive about your health, I'm not saying ignore that you have arthritis in your knee or ignore the current situation. It's more about accepting, yes, I have arthritis in my knee, but I'm doing things about it. And I'm not going to let it impact the relationships that I have with other people, with myself, and believing that there's actually something out there that can help you, and having that sort of mindset that you are worthy of having your best health possible. You can reduce those stress related hormones, you can increase those immune function. And really, what ends up happening by default is you promote better, faster recovery.
Absolutely. So going back to the previous slide, I felt a victim of it for the longest time. 20 years ago, I got involved in a car accident. Someone hit and run. It was hit and run. So for 8, 9 years after, all what I said, why me? So rather than me focusing how should I get better, how can I get better, always focus on what did I do to deserve this? Why should it be me? How come that guy did not get finished? We went to court. He got a ticket, $80, failure to stop at an accident sign. So
Mm,
I was fueled with anger, but I lost 9 years of my life trying to say, like, playing the victim and say, why not me? The only time when I made that shift, you know what, let me find a solution to get out of it. And that's when I found a way to get out of it. And that's what we're trying to share with you, is that power of mind. Rather than me being trapped for 9 years, I could have been over it for a couple of months. Or yeah, you're gonna have that grief, you're gonna have that anger, and it's okay at the beginning, but you can't pull that card forever. Otherwise, you're
yeah,
gonna be stuck and you're not gonna move any forward.
yeah, absolutely. So, what is it that you can do this week and moving forward to really make an impact? If you can identify with, having those moments of negative thoughts about your current situation, like, what can you do to make that situation better? And, one thing that you can do that's really easy is make a list of things in your life that bring a sense of peace, comfort, strength, love, connection. And connection is big, right? Because that's a reminder of why you were put on this earth. That you weren't put on this earth to exist in isolation. You were put on earth to experience that sense of community and what it's like to interact with other people. And once you've made that list, practice every day, engage in even just one thing from that list for a minimum of 2 minutes. Does it bring you peace to play with your dog? Make sure you do that once a day for minimum 2 minutes and really be present with it. In terms of what brings you a sense of strength, is it that you were able to engage in having a really tough conversation with somebody and you felt like you were able to be present and show up, practice that. Show up for yourself every day.
So two things I'd like to add, which is contrary to what we believe and what the medical society suggests, is imagine you have a dog. If you are happy, the dog is happy. If you're sad, the dog will be sad. So that energy is very, very contagious. What I don't like with what we see nowadays is the groups for people with chronic illnesses, for a group of fibromyalgia. It's nice to have that idea, a group for arthritis, a group for chronic pain. But if it's not the intention of it to empower yourself and go out of that,
Yes.
to find solutions to help each other, it becomes like a black hole that sucks you in. One will dump negative energy, the other will pick it up. And now by the
Yep.
time we finish that half an hour meeting, you guys are radiant with negative energy and it just drags you down weeks. And it's no, by the time that comes up, you gotta go for your next meeting. I like you to associate with people who are happier. I like you maybe to go listen or watch some comedy stuff. Make yourself laugh, force yourself to laugh. That's how you're
Yep.
gonna get out of that vicious cycle. You do it with yourself or with someone else.
Yep.
So that takes us to the next slide, which I'd like to bring this because this is there a paradox about what people think and what the results they expect. You might say, yeah, I'm thinking positive. I'm going to be off. I'm going to be good. I'm going to be good. But that thought is just one step. Imagine if you have a kid who's not doing their homework. And every time you confront them with the homework, they say, yeah, I'm going to do it. I promise you, I'm going to do it. You come an hour later to they did not do it. You talk to them about it. They say, yeah, I'm doing it. I'm going to do it. Don't worry about it. A day, two pass by. The only thing that you can measure and trust that thought if there is an action. If that kid did not do the homework after they told you they're going to do it, you're not going to trust them. And if you're not going to trust them, if you don't do that action, you're not going to get the result that you desire. So if you have a thought, don't make it big. Make a small thought for the day. Act on it today. You get a positive result. Now you get your positive reinforcement. You're building little blocks. You go again full circle. You pick up another thought. You act on it. You get results, and you repeat, and you keep repeating, and that's how you build. The worst thing is that you just talk about your thoughts. I'm feeling good. I'm feeling happy. I'm gonna be like any of that stuff. Just thoughts without action. The body eventually will not trust you because they think that the body will literally believe that you're lying to it all the time. Because and when you do a thought, your cells gotta do the action. And if you don't do the action, there's mistrust between the two. And then you come to there's a conflict between you and you. And that's why you need to figure that out. And for me personally, even when occasionally when I go through those pain spells and I can't get out of it, when I go for a walk or I want to go for a jog, I literally tell myself I'm going to go between one telephone pole to the other. I'm going to jog. Even if I felt good after that, I will not jog. I'm going to walk because I promised myself only certain things I'm going to do that and I stop.
Mm-hmm.
So I'm building trust with me. So,
Yes.
right. So when I am short that distance, my body will continue because you always kept your promise. So the body will push, right? But if you have it's all yo-yo, you decide to do whatever you want and you quit whenever you want, your body will never trust you.
Yeah, I think that's so important that you've highlighted that because it's something that we experience on the day to day, but it's so subconscious. And I think it's really important that you brought that to light for sure.
So you're going to talk about the breathing?
Yeah. So essentially, you're a human, we're a human, we have our moments. Like I was sharing with Dr. Mark before we got on the call, my grandmother's got advanced dementia. And so we're navigating that world and we've been a primary caregivers for 7 years plus. And I know I don't experience joint pain, but I know when I am starting to get very worked up with the emotional stress of everything of involved in her care, my mid back starts to get like a numbing discomfort. And that for me is my sign that I'm like, okay, I'm spiraling into a lot of the worst case scenario thought patterns around my grandmother's health. And so, one thing that you can do to actively sort of stop that spiraling is breathing. And so, Dr. Mark had talked about this before with the 444 box breathing. Essentially, you're going to inhale through your nose and you're going to inhale for the count of 4, and then you're going to hold for the count of 4. And then you're going to exhale out through the mouth for 4 and hold for 4. So if you actually imagine what a box would look like, you inhale to one point, hold for another point, exhale for the other point, come back to the beginning of the box. Repeating it 3 times, repeating it 10 times, just really focusing on that will definitely metabolically and physiologically stop that fight or flight response that you were going into.
Yeah, so one of the things from a biochemistry point of view, when you do that, your body becomes alkaline. So you're breathing about 4 to 5 breaths per minute. Most of us, when we get anxious, we breathe 12 to 20 breaths per minute. So we wash carbon dioxide, so we become more acidic. And acidity is just basically a vicious cycle, triggers more anxiety, triggers more that cortisol response. But when you breathe slowly, you literally altering the chemical pH of the blood to more alkaline, and that's when the parasympathetic will kick in. That's when everything calms down, cortisol level goes down. So imagine that you have, technically, think about it as a medicine. The reason I said 10 times, that will give you about 2 minutes, 2.5 minutes. And within that, it's enough for you to alter your chemical imbalances in the blood within literally 2 to 3 minutes. I like this technique before going to bed too, rather than listening to something, watching something. You keep doing that without even a count, you'll fall asleep without you knowing. And it's not about how many times you do it. You just keep repeating it till you fall asleep, because it's going to bring your breathing down to 4 or 5 per minute.
Yeah, I think that's it's helpful, right? And it
Yes.
doesn't cost you a cent. It
No.
costs you $0.
I literally use it at traffic lights. I use it when there's any lineup, which is a lot of them now, anywhere you
Right.
go. Yeah, especially during COVID stuff, you could line up at the doctor's office. You could line up
Yeah.
at any services for a coffee, supermarket. You're always lining up. Hey, you can
Yeah.
do 10,
You know what's
15.
actually wild? It's funny you mentioned that, because I remember, as I mentioned a few weeks ago, I was in the ER myself, and we had spent a total of 7.5 hours there. And I was practicing a different breathing style, but very similar to this. And I swear to God, it felt like I had been there for an hour and a half. And my husband, who was with me, he's like, no, it felt like the full 7 to 9 hours. Like, it felt incredibly long. And it is fascinating when you focus on the breath, because again, that's the only thing you can control in a moment like that, how time, your relationship with time changes.
Yes, 100%. And that's why people, like, you have 3 levels. The 7 hours felt to you maybe an hour and a half or 2. For your husband, it felt 7. For someone else who's breathing really heavy and like 18, 20, they're going to tell you it felt like eternity. It feels like I've been waiting.
100%. Yeah.
So really, that time, you have ability to control the perception of time.
Yes.
And it's all within you by just breathing.
Yeah.
Yeah.
And I want to reinforce, it costs you nothing.
Yes.
So, the saying that, and sorry for the dogs in the background, but healing is not the absence of a storm. Listen, we are living human beings. There will always be, it's never supposed to be perfect. Like, I'm not supposed to have silent dogs all the time, but healing is the way how we ride that storm, how we ride that wave. And we're hoping that by you following through with these webinars, that you understand and pick up ways in which you can learn to ride the wave far more effectively, that you don't go through life thinking that, you know, I have to protect and defend myself so that I don't go through any storms, or that, you know, shit, there's one storm after the other and this sucks and my life is misery, and et cetera, et cetera. We want to teach you ways how you can go through the storm with eyes wide open and come through stronger for it.
Yep.
And so, you know, essentially, like, that's the VIP method, you know. And if you go to the next slide, again, we keep bringing it up because this is the method. And if you trust the work that Dr. Mark and others are doing at Arthritis VIP, you know, you don't get this at any other clinics. You don't, oftentimes you get a clinic that they focus on one thing and not all three of the emotional, chemical, physical stress. And you're getting all of that addressed here. And so trusting that process and putting in the effort to make those changes, you will get the desired outcome that you believe you're worthy of getting.
One thing that I noticed today at the end of the workday, people that live as a couple or as a family might not notice those increases in improvement, but we see them maybe every month, every 2 months, and as they walk in, oh wow, look at them, their posture is better, they're smiling,
Right.
they're able to sit and stand without using a cane or a walker. But because those increments are happening slowly every day, they might not notice it themselves. They need that big contrast
Yes.
for someone else. So you might see someone, it's just like you visiting uh, a friend who has a 2-year-old, and you see them after 6 months, and like you wonder why God, like now they're able to go upstairs, downstairs, they can talk, and they couldn't do all of those. But for the family, I didn't see anything from yesterday till today. So sometimes you get discouraged because you're trying to weigh yourself in your own mirror. And I want you to see someone you haven't seen in 2 or 3 months and let them look at you from a different eye,
Yes.
because they've seen the huge difference that you've accomplished in the last 3, 4, 5, 6 months, whatever that is. And that will give you that positive boost that you're on the right track. And what you start with us literally is just the beginning. And there's a lot you can do at home. We're just here to show you the guidance of what you do, kind of give you a nudge or a push on the right pathway, whether through coaching or through stuff that we do, procedural wise or IV stuff or supplements. But eventually, you have to take ownership of your own life and continue on the
100%.
same path. Otherwise, you're going to fall back and you might need us again or someone else. But reality is, yeah, unless you fix your habits, you're going to be trapped in the same problem over and over again.
Absolutely. Yeah. That's I couldn't have summarized that even better.
Awesome. So do thank you everybody for attending this. And if you have any questions and answer, please shoot it to the team and we'll be happy to answer them either by email or if you're on the next call, then we'll answer it directly with our team here. Awesome. Any comments that you have?
No, other than I'm just grateful that there are practitioners out there who are making this information available to the public, because it is a shift away from the standard, you know, treat the symptom, maybe hope for the best. Some people will do good, some people won't do good. But because you're addressing so much more than that, you are really changing people's lives. You're not just giving them better range of motion of their knees, you're giving them back a part of their life that they maybe didn't even know they could get. So thank you for the work that you're doing.
Oh, you're welcome. We just always tell my patients, I can give you a fish or teach you how to fish. We're gonna do both.
Yeah.
Let's get rid of your pain with whatever modality, but I'm gonna teach you to empower you. So I don't want to see you back, not because I don't like you, because you can do it without me, but we're just gonna put you on the jump start there's a lot of people that we can help, and I don't want you to be stuck in that circle, the same patient over and over and over again, right?
Absolutely.
Awesome. Thank you very much, and have a great night.
You too. Take care, guys.
See you then.
Bye.
Bye.